New study shows that certain blood groups could be less at risk for contracting COVID-19. Researchers studied more than 1,600 patients who tested positive for the coronavirus to find out why there could be correlations between blood groups and infections. Archith Seshadri breaks down the data.
A new study links blood groups with catching COVID-19.
We are studying blood groups to understand if there is a connection of a higher impact of the disease and the infectivity of the virus, depending on which blood group you belong to.
The findings show that those with blood group O are least likely to test positive.
There's some data suggesting that people who are blood group A are more likely to have severe disease, and people that are blood group O are less likely to have severe disease. Now, this is an association, but doesn't mean causation.
But a Red Cross report shows nearly half of African Americans and Latinos have the blood group O, and that ethnic group has some of the highest numbers.
Age groups that are more at risk are, of course, the elderly, so individuals with over 65 years of age. But we are seeing an increased number of severe cases, and sometimes young individuals below 40 years old.
A Harvard study found that people who had symptoms and were either B positive or AB positive were more likely to test positive for COVID-19 than those with blood type O.
So we don't necessarily know anything other than, oh, it's interesting. But again, it's not like we can go and change your blood group.
While scientists don't know why some blood groups are more susceptible, one theory is it could be their body's immune response to new infections, or people with type O blood already have antibodies for both A and B, so their bodies are better able to handle foreign proteins like viruses. Reporting in Atlanta, Archith Seshadri, WJBF News Channel 6.
Some professors say while a link may exist, at this point it's just too early to tell.